So hey everyone, I am Lyan C, and for this video, we are going to talk about the female genitalia of our patient. But for this video, I'm not going still to assess because it's a confidential. So I'm just gonna state the procedure on how to test this on assessing the female genitalia of our patient. So first things first is that we are going to determine to ready the equipments, by the way, the stool, the light, and then some speculum, then some water insoluble lubricant, and then also some culturate, some sterile disposable gloves. Remember, that's very important thing. Some feminine napkins, yes, that's it, and then some pH paper, and then lots of more. And then also, for this assessment of the external genitalia of the female, is that we are going to inspect first the mons pubis. So the mons pubis is, here we are going to note the distribution of the pubic hair of the signs of infestation. So that's how we going to do by inspecting the mons pubis. Next is that to determine the normal finding is that we are going to remember that the pubic hair is distributed in an inverted triangular pattern, and then there are no signs of infestation. So that's it for the inspection of the mons pubis. So next is we are going to determine the inspection and palpation of the inguinal lymph nodes of our patient. So if palpable, so we are going to note the characteristics. So by this inspection and then palpable, we are going to determine also the normal finding that the inguinal lymph nodes should not be palpable. So that's it. So after that is that we are going now to inspect the labia majora and perineum of our patient. So for this inspection is that we are going to determine or to note the color and the presence of some lesions if there is, and then swelling, and then some excoriation. And then after that is that we are now gonna determine the normal finding, which is for this labia majora and perineum is that it should be pink. Yes, the color, the pink, and then some smooth, and then some free of lesions, and then some excoriation if there is, and then swelling. So that's it for a normal finding. Alright, so next is that we are going to inspect also the labia minora. So kaganina is that labia majora, and then ang minora is that the bali na siya dapit sa clitoris, and then the vaginal opening. So mato siya. And then to determine this is that we are gonna note the position, the symmetry, the color on presence of lesions, then some excoriation, the swelling, and then if it also has a discharge. And the next is we are going to now determine the normal finding if it is symmetrical ba siya, kung alignment pa siya, and then sa right and left, and then kung dark pink pa siya, kay momon na ang normal sa ato ang puday, so dark pink. So next is if moist ba siya, right? And then also some free of lesions kung naa, and some vaginal opening and that are below in the urethral meatus. Alright, so next is we are going to palpate the urethra of our patient. So female pa niya siya, urethra. So we are going to note the presence of discharges on it. So if wala gani siya discharge, so natopic naman yun ako ang discharge siya. Another nako assessment is that if wala gani siya discharge, so it means no discharge noted. It means it has a normal finding. The female genitalia of our patient has a normal finding. So that's it. Next is palpating is that the Bartholin's glands of our patient. So for the Bartholin's glands is that we are going to note if there is a swelling, the tenderness, and some discharges also. So So, Bartholin's gland na siya. Alright? So, for the Bartholin's glands is that if it is soft ra gani ang iyang paghikap nimo diri at sa iyang glands, soft ra gani siya, and then no tender or some discharges. So, it means normal ra ang imuhang Bartholin's glands. Right. So, next is we are going to inspect also, but also by palpate. So, by inspect and palpate is that we are going to determine the vaginal mucosa, which is to note the color, the presence, and then some lesions, and then some irregularities of our patient. So, para ma-determine niya, moro gihapon kung smooth ba nimo ighikam yung vaginal mucosa, and then if it is color pink, and then some also moisture. So, that's it. Some normal finding gihapon na siya. Right? So, next is inspection and palpation gihapon siya in the cervix of our patient. So, if you search the cervix, so, muna to siya, cervix, we are going to note the color, and then the size, some position of the cervix, and then some appearance. Syempre, ang appearance, importante na siya. And then, if the presence of discharges na agyapon, and also lesions ko na. So, mo gamit ta og the vaginal speculum, iguan mo sa cervix. So, as we use the speculum, so for the cervix, and assessing the inspecting and palpation of the cervix, we are gonna determine the normal finding if naaman, kung naamo ani midline ba siya, in position also, and then pink gyapon, symmetric, and then smooth, some slit-like, alright, so lesions, and then discharges, lesions or discharges ko na. So, mga abnormal findings aning mga female genitalia is abscess of Bartholin's gland, kuan basta naglain ang iyang puday, and then also some na siya warts, like genital warts. So, so like syphilitic chancre, and the genital herpes simplex, may nana, and then cystocele, rectocele, may nana. So, that's it for stating the procedure and determining the normal finding of the female genitalia of our patient. So, thank you and God bless.